This video is for education and entertainment purposes only. Please consult with your healthcare provider before making any changes to your health plan.
Hey, beautiful soul. It's Jacqueline from the Lost Labia Chronicles in partnership with Lichen Sclerosus Support Network. If you have lichen sclerosus and are looking to empower yourself with information, find acceptance, and reclaim your life, then please subscribe to our channel and keep on watching. And if you have a friend or family member with lichen sclerosus and you want to learn more about the physical and mental health aspects of living with lichen sclerosus so that you can better support them in their journey, then please subscribe to our channel and please share this with them. All right, so I am super excited to be here today. I am so thrilled to be filming this video. We have a phenomenal guest speaker with us today, Dr. Mukta. She is joining us. She is double board certified in orthopedics and pelvic health, and she is just a phenomenal resource for all things bladder, bowel, and pelvic health. So today we're going to be having a conversation about hypertonic pelvic floor, otherwise known as overactive pelvic floor, and sexual health, specifically pain with sex, and how that kind of connects with and intersects with lichen sclerosus. So Mukta, before we kind of jump into things, I'd love if you could just kind of introduce yourself a little bit to our audience, let them know a bit more about your work, where you work out of, and what kind of brought you to the pelvic health space.
Hello, everyone. My name is Mukta Chauhan. Thank you for that lovely introduction, Jacqueline. I have been practicing physical therapy for about 15 years now, a combined experience of both orthopedic and pelvic health. The reason I got into pelvic health is part personal experience, part what I was noticing in the clinic, and was getting curious about some cases that were not getting resolved, and part encouragement and motivation that was given to me by my mentors. So, but number one was the curiosity that drove me to pelvic health. And I am so glad I did the training I did, and it helped me understand my own body as well. And I think it's amazing. And I think having training in both orthopedic and pelvic health gives me this unique perspective of seeing a case from both inside of the pelvis and outside of the pelvis. And I love working with anyone who has pelvic health issues, because it is so, underdiagnosed, less talked about, so much shame and taboo associated with it. So it's just like it's kind of like passion project almost. And I work in Manhattan, New York City, in person, but I see people virtually as well, all over the world. I educate. I love educating on Instagram. I can be found at thepelvic.connection. We can talk about it later more. So yeah, let's dive in.
That's wonderful. And may I just say that I am grateful for your curiosity, because I know the impact that you have on people's lives, and just all the education that you're sharing with people that would never know about this, so I'm glad that you got curious and that you are where you are. So let's start kind of at the basics, right? So what is hypertonic or overactive pelvic floor? And actually, what is the more common term now? Because I started saying hypertonic and then I started seeing overactive. So what's the proper term and what is it exactly?
It's a very good question. And yes, there is kind of like, it used to be called hypertonic before, but then when we say hypertonic, then we are clearly assuming that the tone is heightened in the muscle. But before we go into the nuances, let me just say, overactive pelvic floor is basically the pelvic floor that's just working too much, more than it's supposed to. And a lot of times it's a result of this fear, tension, pain cycle. Lots of different things can lead to hyperactivity or overactivity in pelvic floor muscles, or it could be just it could be primary overactivity as well. If someone has, more hyperflexibility in their body and they are just using their pelvic floor muscles to stabilize themselves. So yeah, there could be so many different ways to for the pathology to work out, but in a broad way to explain what is overactive pelvic floor is just muscles that are working too much too hard.
Right. So they're kind of on overdrive. They're working overtime, and we need them to clock out of their shift and relax a little bit, decompress, do all the things, and then work when we want them to.
And just like any other, I just want to go into, we can talk about the muscles a little bit more. Just like any other muscles, the reason we feel so like out of touch and, we don't know what pelvic floor muscles are, where they are, because we can't see them. They are internally placed. We won't be as alarmed or as, scared about things like, let's say, if there is something going on in our hamstrings or if there's something going on in the calf, like we went for a run and as a result, there was some overactivity in those muscles and I'm feeling some pain. I'm just going to do some stretches and then I'm going to be golden afterwards. So that kind of awareness is not there. As I often say, that we don't have the clear GPS coordinates for our pelvic floor. The brain is always like, the relationship is very automatic. We don't have, aware at a conscious level awareness until something happens. We're like, something is going on there. Otherwise, we don't have to think about when to go to the bathroom. We just pay attention to the urge and we just go. So in overactivity, the crucial thing that's lost is what we call the excursion of the muscle. Just like any other muscle in the body, you have, like, if I use, biceps is the most common example. The biceps is the muscle right at the top of your upper arm. You extend the arm, the bicep stretches, elongates, you bend the arm, it contracts. To strengthen the muscle, you're not going to be holding the elbow throughout the day in this position. Like, I want to get it strong, or, because you have weak shoulder, your bicep could get overactive as a result, actually. But the positioning, because you can see what's happening, right? So you won't do that. But there we can't see it. They stay in hyperactive mode all the time, and we don't realize it until we see a symptom, whether it's pain, bladder or bowel dysfunctions, and those kind of things.
Yeah, I think that's so true. And I love that you speak about the awareness of our pelvic floor muscles, because to speak to your point, I never thought about them or even knew what they were until after I was diagnosed with lichen sclerosus. That's when I started looking more into it. That's when I started to become more aware. But prior to that, I don't know if they were overactive or not. And it's also funny that you bring up the hamstring, because I'm currently working with a hamstring strain. And that was like a very obvious thing for me, because there are certain muscles that we're just more aware of, that we've been, familiarized with our whole lives. And most people don't talk about the pelvic floor, right? You're exactly right, that it's only when there's pain or something goes wrong that we start investigating, and very often we end up with the pelvic floor muscles. So we've got these pelvic floor muscles and they're working overtime. They cannot relax. They are just tensing and tensing and tensing. So, do we have a model of that?
No, I was just going to show, like, usually for any muscle, there is a little bit of extensibility, and then it comes back to its baseline, and then it can contract further as well. So with the pelvic floor muscles, when they go into this hyperdrive, they stay in this, I'm trying to find the angle. So they stay like in this contracted state, and no matter what you do, they don't have the awareness of that flexibility. So this is the excursion we talk about. So if I say, like, because the pelvic floor muscles stay in a hammock-like position, this is how they lengthen and this is how they contract and go up. So an overactive muscle loses this excursion of expansion and then coming back to contract. And a lot of times what people think that, this is again, in the society, if we ever think or take care of our pelvic floor is in regards to better arousal or having better sexual life. And I have seen it so many times that people actually refer it as tight vagina, like having a tight vagina is a better thing.
I've heard that so many times.
So people overdo these exercises, what we call commonly Kegels, or just like contracting. But again, going back to the example of the biceps, you would not stay like this if you want to strengthen your biceps all day long. You want to stretch it out too, because every muscle has an excursion. So, which is lost in this hyper-driven pelvic floor muscle. And since we have so many important structures there that the pelvic floor is supporting, your bladder, urinary system, your sexual, your reproductive system, and your bowel system. So we see the results or the symptoms kind of going towards these systems. And that's when we go into this, hyper alert, hyper vigilant state, like, okay, what's going on? And, what to do about it.
Yeah. And that's when we usually, give a call to our GP saying, hey, something's really off. I've got intense vulvar pain. What's going on? And then a lot of people end up seeing a pelvic floor physical therapist. So in the context of lichen sclerosus, I'm curious, do you think that people with lichen sclerosus might be kind of more predisposed to developing an overactive pelvic floor? Like, I'm wondering, especially because a lot of people with lichen sclerosus, they have a really long history of chronic vulvar pain, of pain with sex, of tearing during sex. Many of them have medical trauma too. A lot of them have been like poked and prodded, their genitals are being poked and prodded by a huge number of doctors over the years. And so I'm wondering, can that kind of traumatic history of having lichen sclerosus maybe lead to this in some cases?
Absolutely, 100%. And like I said, the pelvis is the central part in the body that's supporting some really important structures there. So for it to go into this hyperdrive is very easy. Like, I have noticed this, and I've asked this several of my clients, like, just notice what happens, bring your attention, and they can, because they've been working with me, so they are a little aware of the pelvic floor muscles. Whenever I'm seeing a fight sequence or anything violent on the on TV, a movie, my pelvic floor tenses up. And different people respond differently. We can talk about that as well, like jaw tension in the shoulders, buttocks, clenching of the belly. Some of these things are, go hand in hand. But my point is, again, we don't have very good awareness of that there are muscles, just like any other body part. And B, they are supporting some really important structures. So when something is happening down there and we don't know exactly what's going on, our protective reflex is going to be overactivity in these muscles. Because anytime, like if someone comes to you with a punch,
they're going to block.
We're going to block, or we're going to tense our abdomen. We're going to be like, okay, we're going to protect ourselves. And that's exactly what ends up happening with the pelvic floor. It tenses up to protect everything that's there. I don't know if that it does a very good job by tensing up and staying like that, but its intention is good. It wants to protect us. So absolutely, going from doctors to doctors, getting different kind of testing done, not understanding exactly why we are experiencing, pain with sex, or having some other, symptoms down there could kind of perpetuate this fear, tension, pain cycle. More pain, more tension from guarding, more tension, more pain kind of thing.
Yeah, and then it just becomes this vicious cycle, and then it's really, really difficult. And I can relate to that because I had overactive pelvic floor as well. And I think that a lot of that was, again, that fear, tension, pain cycle, because for me, one of my earliest symptoms of lichen sclerosus was tearing with sex, which is painful physically, but also very mentally distressing to tear from that. And so I think, subconsciously, each time after that first initial tear, my body was always apprehensive. It was always kind of like, ooh, is that going to happen again? I need to protect her. And because I kept trying, I would keep tearing. And, the tearing got worse. The pain with sex got worse. And, looking back, I do think that the overactive pelvic floor was playing a role. So it's not to say that it was only the overactive pelvic floor muscles or only the lichen sclerosus. I actually think it was both, right?
Yes.
So lichen sclerosus was causing the vulvar skin to change, which led to tearing and pain on that. But then as a consequence of that pain, my pelvic floor muscles just started to, again, tense up, right? They're trying to protect me. So, I appreciate that. But, of course, that did make it even more painful and even more difficult to have sex. And so maybe we can talk a little bit about overactive pelvic floor muscles and sex. So how do they contribute to kind of pain with sex, and what kind of issues can people come up against if they have, overactive pelvic floor and are trying to have sexual intercourse?
Absolutely. And I think it would be important to understand a little bit of anatomy of the pelvic floor it's like, why is the tearing causing, pain-wise, it makes sense, apprehension, pain, of course, protective guarding of the muscle tension, but why why so much tension in the pelvic floor? And why doesn't it go back to normalcy in that baseline relaxed state? So the pelvic floor muscles are actually, my model is a little broken because it has fallen from my hand multiple times while making videos, but angle. Okay. So pelvic floor muscles we usually say there are 3 layers of pelvic floor muscles. They're not just like flat, usually explained hammock-like shape. They are actually literally placed in 3 different layers. So this most superficial layer, which is, it's supposed to go all the way from, the camera is disorienting me a little bit, but this is your sit bones. So one of the muscles, superficial transverse perineal, goes all the way across like this, and which is pretty much at the base of the opening of the vagina. And there is another muscle that goes along the entire length of not the length, but the opening of the vagina, and it's called bulbospongiosus or bulbocavernosus. And then you have another muscle that goes, so there are 3 superficial muscles, and ischiocavernosus that goes from your ischial tuberosity all the way to the top part around the urethra and clitoris. So these are the 3 main muscles, I would say, that are most important for us to understand the pain with insertion. People can also experience pain with deeper penetration, but they are it's almost like, so let's try to understand the cycle. You're getting some tearing happening right at the outside. The skin is tearing. Then since these superficial muscles are right around there at the opening of the vagina, they are getting tense. Like, okay, we can't really open or expand the way we need to for penetration to happen. Everything, and as this tearing heals in lichen sclerosus, the skin becomes fibrosed and thickened plaque-like skin, which takes away the very beauty of the skin around the genitals, which is the expandability. The skin is supposed to really expand with the muscles to allow the penetration to happen. Since that isn't happening, the muscles also get very tense. These muscles are usually the bulbo and the superficial transverse perineal can become thickened from overactivity, because it's like, okay, I don't know what's going on. There is too much tension here. The skin is not pulling. So we are feeling more pulling in the muscle itself. So they're kind of resisting that pulling and become tense as a result. And that's one of the biggest reasons for people to feel pain with insertion. It could be any kind of insertion. It could be like just inserting a tampon or a menstrual cup, or penetrative sex, of course. If we allow this to happen and continue to happen for a long period of time, or before somebody, their medical provider figures it out and send them to the pelvic PT, or at least tell them like, okay, you need to take care of this area. The tension in the superficial muscles can go into deeper muscles, which is basically sit like a bowl in the, it's like, these are the muscles. You can't really feel them from the outside. Only superficial muscles can be felt from the outside.
Right.
So these are the muscles that support the organs. Then they become tense. When they become tense, then the organs start to get affected as well. So some of the times with lichen sclerosus, I have seen some patients experiencing urinary urgency frequency, which is a very common sign of pelvic floor dysfunction. So yeah, this is kind of like a dominoes effect, like, starting at a superficial level, and now it's going deeper and towards organs also. So yes, definitely the tearing or the changes that are happening on the outside can affect the pelvic floor muscles.
Yeah, and I think that really speaks to why it's so important to get diagnosed early, because, we're talking about, first the superficial layers are, affected, but then as we keep perpetuating that fear, tension, pain cycle, and as we keep getting injured, like, then it can start to impact those deeper muscles. Yeah. And so, if you're looking at someone that took them, 8 years to get diagnosed, it's like, well, by the time they get in your office, it's probably not just going to be the superficial. There's probably going to be some impact to those deeper layers as well. And I agree too that I commonly hear kind of in the LS support spaces that people are always asking, does anybody else have urinary frequency or urinary retention or just urinary kind of symptoms? What's going on? And usually, my first thought whenever somebody mentions urinary issues does go to the pelvic floor. And so your explanation really helped me understand why that could be going on. So I kind of know now that, urinary issues could not necessarily, but at least there's a possibility that there's pelvic floor implication. Yeah. But I never really quite knew why. And so I really appreciate you showing, because I'm a visual person, and I think that especially when we're trying to learn like new information for the first time, seeing it can actually really, really help. And another thing that I found really helpful too was we think with lichen sclerosus it affects the vulva. So we're like, well, that's not the pelvic floor muscles, right? Like they're two separate things. Like they're not really connected, are they? But in seeing that, I was like, oh no, they're really intimately connected. Yeah. So two different things, but they're connected.
Yeah, it's so true. And I think that's why a lot of people get confused when they experience one thing and then you ask, like, in my head, it's all connected because I see this every day. I'm trained at this. But as as just a lay person, when I started to experience I had some pelvic pain as well. And I have shared this with you before that I was misdiagnosed with lichen sclerosus. So, I mean, I was kind of like going in circles as well, like, okay, why do and I still get sometimes urinary urgency frequency. But what I wanted to tell you is like a lot of times people get really confused when they come in with urinary urgency frequency and I ask them, are you constipated? And they're like, what do you mean? It's like everything is just so closely connected. The uterus is over there, but I'll show my hand. So your uterus goes right over your bladder and the rectum is right behind it. Like, how can these organs not affect each other? How can the pelvic floor, which is like right under these, like supporting these organs from below, how can it not get affected? How come the skin, which is right outside, it's like skin is not separate, like it's connected to the muscles through fascia. Like everything is just there. The skin is actually covering the top layer of these muscles. So of course, if that's fibrosed, it's going to get, the tension is going to go deeper and deeper and deeper.
Mm-hmm.
So of course, yeah.
Yeah. And I think it also, you know, to kind of tie back to what you were saying before with like everything is connected, but you were mentioning like jaw tension. And it's really interesting because, again, sometimes we just tend to think of things in isolation. So my upper back hurts. Okay, it's just the upper back. But if that pain and that tension, if I don't work on that, that can start going to the mid back and the lower back. And when the lower back starts to go, you can get hip and glute pain. And it really is all connected.
Yeah.
And so, yeah, I have been hearing a lot about this jaw and pelvic floor. So how does that work exactly? I'm curious.
So I have been trying to dig some research articles as well. The most I could find in terms of what has been found out, it's basically when someone has jaw tension, they have found like it's almost like a behavioral pattern that people just hold tension in different body parts.
Mm-hmm.
So that's what they are saying. They were trying to connect it to fibromyalgia kind of a thing as well, because again, in fibromyalgia, it's kind of similar, although it has other pathologies as well, but people may have a tendency of holding tension for whatever reasons, you know. But to this point, I would also like to say, let's not forget the central sensitization and the role of the nervous system in this entire picture. Again, like, you know, when a condition is, and I will explain that, what that big mouthful word is. But like we're always thinking in terms of like what's happening at the local surface.
Mm-hmm.
But again, I think the entire body, and we always think about that it's the fascia that connects us from top to the bottom. And you know, it's a very commonly used, sometimes overly used phrase in physical therapy, like, oh, your body is connected, your fascia goes, but nobody says like your nervous system goes from all the way to the top.
Yep.
Like your nervous
It
system
sure does.
is you know, how do we not talk about that enough, you know? And you know, I see this very often, and I'm going to say this first, give this disclaimer that a lot of people who are in chronic pelvic pain hear this getting dismissed from their different providers. Oh, it's in your head, or it's really not, you know, let's say you started to feel some pain, tension before the even like actual physical symptoms start to appear, where they could say like, oh, this is lichen sclerosus. You know, you're experiencing pain. This is your experience. It's absolutely real. However, pain is a product or processed in the brain. It's the nervous system that's taking care of us. Nervous system is our parent. You know, the nervous system is trying to see exactly what's going on in different parts of the body. It's not like something is happening at the vulva level and the nervous system's like, oh, okay, fine. Yeah, it's
right.
You know, the kid is out the door, you know, empty nest. It's not like that. The nervous system is always connected. It's getting the information. The reason we feel pain is because certain noxious stimulus, for example, feeling of pressure, feeling of the tearing sensation, what we call noxious stimulus or nociception. It goes to the spinal cord, and from spinal cord, the information goes to the brain. And then brain, different, like research has found there are approximately 9 areas in the brain that work together to process all the information coming from the body to figure out the appropriate response, whether we're going to tense up, whether you're going to run away, whether you're going to take rest, whether it's going to dial up the pain, you know, volume up. It's different things that brain is trying to figure out. And it's also taking into account what is your environment like. Are you in a supported atmosphere, supported environment? You have loved ones taking care of you, or you're in a flight and fight. You're an immigrant. You come to big city like New York City, and you're like, okay, what? I don't know anyone. And you're just like always on the edge, you know. That was a little bit of my experience, but you know, a lot of us can relate to that in different levels. And again, your previous thoughts and your culture can, like, again, from my own example, coming from a very conservative society where, sex is a taboo topic, it's very obvious, why my pelvic pain started. It's like, what is going on? A lot of, shame, guilt about, experiencing sexual pleasure itself is such a daunting thing, and you have to kind of, although you're an educated person, but these thoughts are always kind of going in your head all the time. And a lot of times what I have seen in my pelvic pain patients is because it affects relationships a lot. Because if you're not having been able to have pleasure with sex, you're always at the edge, like what's going to happen to your relationship. And sometimes people push themselves to just make their partners happy at their expense, so I see that quite a bit as well. And like, I need to be, and I have been getting a lot of like, DMs from India as well, like, I need to figure it out, otherwise my husband is going to divorce me. So like, it really depends, like which part of the country, which part of the world you're from, what are your cultural beliefs. Maybe Europeans are a lot more chill about this, not saying that everybody is, but just to delineate that there are differences in cultures, and that can really impact our perception of pain and how we process whatever is going on with our bodies. So central sensitization, that was a long detour I took. But central sensitization is basically meaning that your nervous system is becoming just like your muscles, they go in hyperdrive. The nervous system is going into hyperdrive as well. You're becoming hypervigilant. Every sensation, you're just sitting comfortably, maybe sipping a cup of tea, yet your brain is like, I felt something. And that overwhelm, that too much information coming from one body part kind of is taken by the nervous system as a sign of danger all the time. And danger is equal to the intensity of pain. The more danger the nervous system is going to experience, the more it's going to increase the pain dial because it wants to protect you. It's that helicopter parent.
Right.
So that central sensitization is super important as well. But a lot of times what ends up happening, I have seen this as well, medical providers just say, oh, this is central sensitization. Basically, there is nothing can be done about it. You go ahead, just reduce your stress and, make these lifestyle changes. And I don't know what else to help you with. And I think that's a disservice because you're just giving it a medical term, but still dismissing someone's pain. That's not what central sensitization is all about. There are lots of therapies. There are lots of, things that could be done about it. And there are medications as well available for it. Some of my pelvic pain, vulvodynia patients do really well on gabapentin or, sometimes amitriptyline and these kind of things. That is helping. In the short term, it can really help with that central sensitization component. It's kind of calm down the nervous system.
Yeah. And I agree that, giving it a name is one piece of it, and naming something is very important. But then follow up, here are your options. Discuss those options. And if you don't know them, refer them to somebody that does, to somebody that can help them, because there's nothing more frustrating than being given a name and then being told the door is here.
Yeah.
Because and then at most, reduce your stress is true, but maybe,
tools.
It's so unhelpful. That's just it, and like, you're not wrong.
Yeah.
But, telling someone just reduce your stress and you'll be good. It's like, they have no idea what to do with that, and I think that's really frustrating. And I really love that you're bringing the nervous system into this, because when we say everything is connected, we really do mean everything. Fascia, muscles, the nervous system, everything works together. If you really sit back and think about it, it's absolutely incredible. the human body is mind-blowing.
Yes.
How it works, you know, it's like,
Yeah.
we're like a whole tiny little planet in and of
Yes.
itself. Like it's just, it blows my mind every time. And I also love that you bring this up, because I think it does put things into perspective that, you know, with respect to lichen sclerosis, we want to look at treatment and management from a holistic point of view. So yes, we know that steroids are the gold standard and that they're very effective at reducing inflammation and getting patients into remission. But there's all these other pieces that matter too, such as your pelvic health and, you know, looking at your nervous system. Is your nervous system on overdrive? And if it is, where can you go for tools to start working on bringing that nervous system down, right? Because, you know, I'm thinking of the example you said earlier, like if I'm going to punch you, and I'm thinking basically of myself walking around feeling like someone at every time, every second of every day is about to punch me. How tense my whole body would be to just constantly be on guard. And I hear this so often with people with lichen sclerosus, you know, that come to lichen sclerosus support networks, virtual meetups. So many of these people are in this state of just, you know, hypervigilance and overactivity of the nervous system and overactivity of the muscles. We'll often hear people, you know, of course they talk about their vulva, but they'll also talk about their bladder and their bowels and their back pain and their hip pain and their glute pain. And it makes sense when we put it in this bigger picture kind of lens that you just kind of gave us. It really makes sense. And so again, I love approaching LS from a holistic standpoint, right? Yeah. Steroids, pelvic floor physical therapy, you know, sex therapy, really just borrowing from all these fantastic resources that we have out there, and then kind of building a team to help us with that. So coming back to kind of overactive pelvic floor, so we know that can cause sexual pain. And that sometimes it can be more superficial, and that if we let it go for a while, it can start impacting those deeper muscles. So if somebody has lichen sclerosus and they have overactive pelvic floor, what can they do? What can they do to work on letting those muscles relax again, and hopefully making it such that sex isn't so painful for them anymore?
Yeah. So number one is always best to get assessed, at least. I know a lot of people either do not have access to pelvic PT in person, or sometimes it's too expensive. There is no denying that. However, and this is just, I wanted to say, like, you know, when we talk about holistic approach, it doesn't mean that you need to do everything at the same time. Like there is no way we are trying to overwhelm you in any sense that, oh, do all these kind of therapies. However, I think the first thing you could do is just getting a sense and awareness of your body. Like what exactly is going on? Sometimes doing one session with most of my patients, for example, just giving them a handheld mirror, showing them different parts of their vulva, teaching them about some of the structures, like some superficial pelvic floor muscles that they can see, making them feel how you can contract and then relax them, working on their diaphragm, their belly, releasing that tension in and around the pelvic area, gives them this understanding and awareness, like, oh, okay, I'm feeling more released, and this work I can do on my own. So I think an assessment is definitely important. Like, you know, there are so many different exercises, like usually on social media, because we are giving a very generic advice, we teach a lot of diaphragmatic breathing, because the diaphragm works with the pelvic floor, where it kind of, you know, both of them do the motion in a wave-like fashion. As as you're inhaling, the diaphragm kind of goes down, and that pressure that comes from above stretches the pelvic floor downward. Of course, it's not such a big movement, but to understand, like, diaphragm and pelvic floor work together. So a lot of breath work is also helpful in calming the nervous system. So breathing helps two ways. It's calming the pelvic floor and also calming the nervous system, reducing that hyperdrive. A lot of times, just like I said, just getting educated about their pelvic floor, how these muscles function, can take away the fear component, that uncertainty that comes with such diagnosis that, the doctors always say it's always the management, and, there is no resolution as such, which could be, nobody likes to hear that. All of us want to get fixed. So that acceptance can take some time as well. But I think just starting with learning your body can go a really long way. Take your time, understand how these muscles work, and then maybe, okay, I'm ready for the next therapy. Or, maybe I need to see, a sex counselor or sex educator to get more educated, how I can, there are so many different ways to receive and give pleasure. It's not just like how the society makes us believe that only penetrative sex is the best kind. It kind of like takes, it opens our mind about that as well. And then, of course, like, I always encourage my clients for receiving therapy, which I don't know, I think it's a silver lining of the pandemic that people started talking about their mental health quite a lot more openly. So I think it used to be a really hard thing for me to approach my patients with, like, if they are seeing someone. But now I can just, like, right off the bat, I can ask, and they understand, and they know why I'm saying. But if someone is completely like, they're like, I don't understand why you're talking about it, like, I can discuss it with them. But I always tell them, whenever you are ready, please don't feel pressured about anything.
Right.
But definitely, like, combination of these things is always really work beautifully, but only when you are not feeling pressured about anything.
Yeah, I think that's a really important part. And is overactive pelvic floor, is that something that, like, someone can completely get rid of?
Absolutely.
It is. Okay. Yeah. I think that's really reassuring because, with lichen sclerosus, right, we're told you have it for life. You have to learn to manage it. So sometimes when people say, oh, I got my diagnosis with, lichen sclerosus, I was diagnosed 6 months ago, and now I just got a new diagnosis. It's overactive pelvic floor. And it feels devastating because now they feel like they have two kind of genital/pelvic conditions. And sometimes that feels really, really defeating. But I think that it might be really helpful for folks to know that, at least for this one, this is something that you can work towards completely getting rid of. And then you just got to bring the focus back to managing, the lichen sclerosus. So I think that's really encouraging to hear because, you don't want to hear that you have a secondary pelvic/genital condition that is for life, so.
Yeah, and I think that's why it's also important to, like, I mean, we can call it overactive pelvic floor dysfunction. But I think the least, I would like to use the term which has the least amount of fear around it, like tense muscles. We can train muscles. Let's just train the muscles, and we'll be fine. And again, like, it's not like that once the tension goes away, it cannot come back. Again, muscles, we are muscular, we get tension in different parts of the body. That doesn't bring that kind of fear in us, like, oh my God, it's back, So, like, for example, I always, every time there's a gap between whenever I'm biking, if there's a gap in between, I always get this pelvic floor tension from it. And then I get maybe a day of urgency frequency kind of symptoms, but it's annoyance at best. It doesn't get to the point of, oh my God, what's going to happen? Because remember, the pain, what is it? The fear, tension, pain. So the fear is the danger signal for the brain. Whenever the brain experiences subconsciously, consciously, any kind of fear, it's going to go into this hyperdrive, and it is going to tighten things up. it's going to increase that pain dial up as well. So we have to always remember that. And it's okay to be fearful every now and then. We are humans, you know.
Yeah, of course.
But know that we're not in the wild. We are in a safe place. So giving yourself messages of safety. And I think that's why the education, when we teach them different parts of the vulva and where is what and where they're feeling pain, can really help reduce the fear and uncertainty about this thing. But whenever someone feels tension, once they have figured out how the tension is resolved for them, maybe they have very tight hips, maybe they have very tight back, maybe they have very tight abs that they're always clenching, or buttocks, or they have a very shallow breath. All these things are assessed in a physical therapy session. And that's when we determine, like, okay, your first exercise, these are the kind of exercises you're going to be doing, which is going to help your pelvic floor the most. So it's not always just the internal release work. It's not always just about the pelvic floor. We have to really think about how different muscles in the area are affecting the pelvic floor to have like a more long-term resolution, rather than just doing some massage and letting people feel this, short-term relief.
Yeah. And I think it's really good too to kind of set the expectations for the patient. So yes, this is something that we can get rid of, but also it can creep back from time to time, right? Like, I'm sure everyone's had tension in their shoulders, and you get a massage and you do some breathing and stuff, and then you feel really good. And then, I don't know, you have a few back-to-back meetings and you just get the tension back. But I think the difference is that, like you said, there's the education part, which is, now I understand what's going on in my body. And for me, as somebody with anxiety and with health anxiety, that's been a huge tool for me, because I don't go into that panic mode. So if I do notice that my pelvic floor is tense, I'm not afraid anymore. So I just tell myself, oh, you're tensed. This is happening. That's okay. You're still safe. You didn't do anything wrong. And you have the tools. You know what you need to do now. And, those tools are the tools that you learn in kind of pelvic floor physical therapy. And those are tools that you get to carry with you for the rest of your life. And many of them are things that you can do anywhere, right? Like that breathing, that's something that it doesn't matter if you're at home or on a bus, if you're at, your sister's place. A lot of these things are things you can do almost anywhere. So I find that understanding pain and understanding what's going on in my body, having the awareness, is really important too. And I think that is something that a pelvic floor physical therapist can help you with, is having that awareness. Because like you noted at the beginning of this conversation, the pelvic floor, we just don't kind of naturally have good awareness of this prior to, something happening. Like I never did. I had awareness of my arm muscles, my glute muscles, my leg muscles. I didn't, have any awareness. That was something that I kind of learned in pelvic floor physical therapy, and then really focusing on growing that awareness and just being more mindful of my whole body.
Yeah.
So that plus, understanding the pain, and then having the tools, knowing, okay, I know what to do. Because for me, I freak out when I don't know what to do, right? Because then I feel stuck. That to me brings me to a helpless place, because I feel like, all right, I understand what's going on. I know where it is, but I have no resources to help me with. It kind of makes you feel like you're drowning, and that you're desperately trying to get somebody to lend you a hand and pull you back in. So I think that's where, having those resources, having those tools, knowing what to do if this happens, I think that can really help with a lot of anxiety that can kind of, pop up whenever this does resurface, because many things kind of resurface with our life, right? I mean, the world is a stressful place.
Yes.
That in and of itself is a reason for tension to kind of come in and out of our bodies, and especially if we're kind of chronically stressed, which a lot of people are. Living with chronic pain is stressful, but also just, again, this world, can be very stressful too. So speaking of the awareness component, kind of one last question I wanted to ask you was, if somebody has lichen sclerosus, but they're like, I don't have any pain in my pelvis. Do you think that they could still benefit from at least going for a visit with a pelvic floor physical therapist and getting an assessment?
Yeah, absolutely. I think it's almost like that's my ideal patient, because you're trying to prevent something before it happens, and again, like just like you said, lichen sclerosus is not something that it's just going to go away. It can go into remission, but it can come back, and you have to be more aware of how to handle it better. So why not take care of it when actually you are doing okay? Just like how they say, therapy works the best when you go with the best state of mind, and you can work on it on yourself a lot better. Just the same way, like you have strong, resilient body. You probably can really understand how the muscles tense and expand. You can do that. So in the future, if you ever experience some of these symptoms, you're like, okay, I have the awareness. I know where these muscles are. I know exactly what tools to apply here, which could be a little tricky once you already have the pain, because a lot of times when patients come in and we give them different kinds of cues, we give them different kinds of props, we show them how the muscles expand, different kinds of things to give them that feeling. And they're like, I am expanding, but they are actually contracting. Like it becomes so, like the connection is lost to a degree where I don't know what to do. And again, like, it's not that we can't help them from that point. Absolutely, we can help, and they always get better. But it can take a little longer path, because now sometimes we have to take several sessions. We have to do more of a manual work to release the tension all around before they can start to feel the resilience in their muscles of expansion and contraction. So absolutely, if you could see and like I said, like you could just like start with just one visit, figure out what works for you. What are your questions? A lot of times pelvic PTs are better educators because we have more time, A, and B, I think we are just better.
I mean, I do too. So, I agree with you.
So, take advantage of that. And, that's a key component, I think. I've had several patients who would just come for one visit, and they say right off the bat, like, we're just kind of come for this, and then we'll think about it when to come back. And it's absolutely fine. You don't have to feel pressured that now you're going to have to go back into therapy 2 to 3 times a week, and you don't have time for it. Just go for one visit, get educated, understand your body, and start using these little tools that you learn there over the time of several weeks. And then whenever you're ready for more intense therapy, you can always go back.
Yeah, I love that. I know that, we kind of discussed this at one point when we did an Instagram live together. And I remember telling you that I wish that when every single person got diagnosed with lichen sclerosus, that their doctor, in addition to their steroids, also said, go for an assessment with a pelvic floor physical therapist. Because, and I think this brings back to the awareness piece, right? Because again, a lot of people will be like, well, I don't have pain in my pelvis. It's lichen sclerosus that I have, but you just might not have that awareness yet of the pelvic floor to really be able to see, like, oh no, I am really tense there. Because that was me when I was diagnosed. I did 2 things. Like right after getting diagnosed, I got a sex therapist because I knew that this was going to affect my mental health and my sexual health, and I wanted to get, address the mental aspect. And I got a pelvic floor physical therapist, but I didn't get a pelvic floor physical therapist because my doctor told me so. I actually got it because I have degenerative disc disease. And so I've been in and out of kind of, rehab centers for my spine for ages. And I'll often sit in the waiting room, and they always have like the list of all the physiotherapists and what they do. And I saw that a couple were pelvic floor physical therapists. And I was like, what the heck is that? And then, you're bored waiting, for your turn. And I remember always seeing that they specialized in urinary issues, bowel issues, pregnancy, birth, and pain with sex. And I think that kind of always stuck in my head because that's something that I had. And so when I was leaving my doctor's office, I thought, and I didn't even know, like, about the pelvic floor connection to the vulva at that point. So I was just like, well, if they can help with pain with sex, maybe they can help me.
Yeah.
And so I decided to go for an assessment. And if you had asked me, do you think you have pelvic pain or any kind of pelvic floor health issues, I would have said, no, my pelvis is fine. It's my vulva. But, and I'll just say this really quickly, I went in for the internal exam and she inserted a finger into my vagina and she said, okay, tense. And I tensed. And then she said, okay, great, release, like relax it. Nothing happened. Nothing happened. It was like a death grip.
Yeah.
And I think it took me about a minute or two to actually release enough. And it took so much concentration. And in that moment, I remember being struck. I was like, okay, so my body is really good at tensing, but it has no idea how to relax.
Yeah.
And so, for me, that was really an illuminating moment, because it reminded me that, just because I didn't think I had pelvic floor issues doesn't mean there isn't something there. And I think that the best thing to do is just go for the assessment, right? Worst case, they tell you your pelvic floor is magnificent. There's absolutely nothing wrong. Or they say things like, great, here's some, tips and tools and education pieces. And also, if anything does occur in the future, now you have a pelvic floor physical therapist on your team that you can go to. And that's, a great resource to have. So yes, everybody, if you have lichen sclerosus and you have not gotten assessed by a pelvic floor physical therapist, if it's accessible to you, definitely encourage it. And Mukta is so right in that they do give you more time. It's not a 10-minute session. They have a full hour with you. I mean, some places may vary, 60 minutes, 45 minutes, but they have so much more time. They really take their time, they listen. And in my experience, pelvic floor physical therapists are also trauma informed, which really transforms your experience. And everyone that I know with LS that went to pelvic floor physical therapy told me they were just astonished, because it was such night and day from their experience with, the doctors and the gynecologists. They're like, oh my gosh, this person asked for my consent. They responded to my emotions. They made me feel safe. They communicated. And it can just be a really nice experience, especially for folks that have had such traumatic ones. So before we kind of wrap things up, is there anything that you wanted to kind of mention on this topic that we didn't get an opportunity to say?
I think I would just say that, the number one is do not hesitate in getting an assessment done. You can always learn so much about your own body. And just like Jacqueline said, it's likely that, you may be developing some tension, but it's also likely that you don't have tension, and you can learn like, oh, okay, this is how the pelvic floor is supposed to function. And you can actually be more prepared if something would happen in the future. You'll be like, okay, I know exactly how to release the tension from my pelvic floor. Despite that, I am getting some issues. So you have a lot more information that you can present to your doctor or your therapist, in a subsequent visit. So definitely, like I said, always end these conversations with, there is no TMI when you talk about your pelvic health. We're going to be talking about your pee and your poop and your, we may even ask what position hurts the more, and, all kinds of different things we ask. And I think people appreciate it when, sometimes they get a little nervous, but, it's always, they appreciate that, they can finally talk about a lot of things that they never thought are okay to discuss. And I think that is so very important when it comes to pelvic health.
I love that. Well, thank you so much. And if anyone wants to kind of follow you or ask you questions or work with you, what's the best place to find you?
Well, I am very active on Instagram. I love to make educational videos. So you guys can check me out at the pelvic.connection. I forgot my own handle.
Happens to the best of us.
And I recently made my website live. It's drmuktachauhan.com. And I've been trying to, like, a lot of people complain on Instagram, like, it's too quick, it's too fast. And I'm trying to be more like writing longer blog posts to, explain stuff. So you guys can check me out there. I have all the information on my Instagram page as well. If you want to work with me or just do a one-time consult, or my website, you can send me DMs if you have any questions too.
Perfect. Wonderful. Well, thank you so much for joining us today. I learned a tremendous amount, and I'm sure our viewers did too. So thank you again on behalf of Lichen Sclerosus Support Network for joining us for this conversation. Thank you to everybody watching. If you liked this video, if you found the information helpful, please leave us a thumbs up. Feel free to ask questions or leave your comments or share your experience with pelvic floor physical therapy in the comment section below. And of course, if you are looking for more education and support, you can always go to Lichen Sclerosus Support Network's webpage, which is lssupportnetwork.org. And that is it for this video. I will catch you in the next one.
Thank you so much for having me.
Bye.
Bye.